Good morning, everyone. My name is Philippa Collin, and on behalf of Professor Kate Steinbeck, the Director of Wellbeing, Health and Youth Centre of Research Excellence, who is currently on leave, I'd like to welcome you to our Y webinar. I am a co-stream leader in the Y CRE. I co-lead Stream 1, the Ethics of Engagement of Young People in Adolescent Health in a Digital Age, along with Professor Angus Dawson, and it's my pleasure to be hosting the seminar today. To get started, I'd first like to just acknowledge our partners in the YCRE, and also to acknowledge that we're all joining this seminar from diverse traditional lands around Australia, and I want to acknowledge the traditional owners of all of those different lands from which we're joining. I myself am on Bedegal country, and I pay my respects to Bedegal elders, past, present and emerging. And I invite all of you to add into the chat an acknowledgement of the country that you are on today. Today's webinar is part of the community of practice that Y coordinates, and you can find many resources, including from past webinars, up on our website. It's essentially a place where people can come together and share resources and information and research around adolescent health. And today's seminar will also be shared up there at a later date. Just a little bit of housekeeping before we get going. During the webinar, you will all be muted and your video will be switched off. If you'd like to say anything or would like to ask a question of our presenter, Dr. Jess Heerde, you can use the chat panel on the side of your screen. The formal presentation will go for about 40 minutes, after which we will have time for Q&A at the end of the presentation. So please add any questions that you have at any time into the chat, and we'll add them onto the Q&A at the end. So let me now introduce our presenter for today's webinar. Dr. Jess Heerde is a Senior Research Fellow in the Department of Paediatrics at the University of Melbourne. She's also an NHMRC Emerging Leadership Fellow and an MDHS University of Melbourne Momentum Research Fellow. I'm not sure what that means, Jess, but I'm sure we'd all love to know more. It sounds really important and exciting. And Jess has established a program of research, an important area of research around the drivers of homelessness and health consequences of homelessness among young people. And certainly that's an extremely important issue at the moment, as we see housing become so challenging for so many of us here in Australia. So Jess, welcome. Thank you for joining us today. And over to you.
And thank you for having me. And look, it's really lovely, to get an invitation to come and to talk about this work with everyone. It's I think homelessness, particularly among young people, is not something that gets a lot of attention. So I feel incredibly fortunate to have got a grant to really get stuck into some of the health. And we have lost slides, Pip. I don't know if you can bring those back, please. So as I said, it's really good to have the opportunity to talk about some of the work that I've been doing, and hopefully you all find that interesting. So I thought I'd start just by giving you a bit of an overview of where I sit. So I'm a research fellow at Melbourne Uni, and was lucky enough at the end of last year to be awarded an HMRC grant. And Pip mentioned the Momentum Fellowship before, and just briefly, that I think it's worth mentioning because that's a fellowship that Melbourne Uni have brought into our faculty, or our faculties developed to support people who've had significant career disruptions. So for me, I live with a chronic illness, and that fellowship is really, to assist my work. And so the premise of my work is really around life course epidemiology and related to homelessness. So for me, the key things are, what are we need to really think about what's going on for young people before they enter homelessness, and how can we target those drivers to stem the flow of young people that enter homelessness. But in that, I think it's really important to acknowledge that regardless of what sort of prevention or intervention, approaches we have, we're still likely to have a scenario where there are some young people that enter homelessness. And for those young people, my second stream of work is really around how do we decrease the length of time young people experience homelessness and decrease the impacts of that through access to healthcare. And how do we decrease, morbidities and mortality that might arise from experiencing homelessness. So my work really focuses on those four groups that I've got listed at the bottom there. Young people who are at risk of homelessness, young people who enter into homelessness, those young people who have had experiences of homelessness and are now in housing, because I think one of the things we don't, think about a lot is, or think about in a long-term fashion, is the impact of homelessness on an ongoing basis. So even though young people might have come through that experience or survived that experience, there are still long-term impacts that I think we need to really consider and address. And the last group there, which can be a bit confronting for some, and I do acknowledge that with the group that we have here today, is young people who have who have experienced homelessness and have passed away during that time. That's a group that I don't think gets enough attention, but I think it's something that we really need to look at if we want to keep pushing action around addressing homelessness. And I will just say that I'm more than happy to answer any questions on any of this. So yeah, please feel free to put them in the chat. So I don't want to spend a lot of time on this, because I think we probably already, the group that is here is probably a group that is well versed on homelessness and issues that young people face. But I guess the main things that I draw from this is, we have intervention approaches, we have programs that we're running, but stemming the flow of young people into homelessness still remains a challenge. And particularly for young people, like I've got there, over 40% of young people who accessed homelessness services in the last year were under 25 years of age. And I think that's a massive proportion that doesn't really get enough attention. We know that, homelessness is a driver of poor health outcomes. We know young people who experience homelessness have their educational and employment opportunities severely impacted, and we know that then there are other social inequities that develop from that. So this is something that we need to address in its entirety, because it does have impacts later on into life, and that's, I guess, one of the things that I'm trying to shine a light on here. Around mortality, we don't really have figures for young people, but what we do know internationally is that life expectancy for adults who experience homelessness is quite low. So that in itself, 45 to 47 years, is significantly less than the average lifespan for someone who doesn't experience homelessness. And as I said, we don't know what it is for young people, but that is something that I am going to try and put a figure on over the next few years with my NHMRC work. So in terms of existing research on pathways into homelessness, we don't know a lot. I think that the thing that we can take away from the research that is there is prior studies have really looked at selected samples. So most of what we have are studies where the participant group are young people who are already homeless or have experienced homelessness. And they're often small samples without a comparison to young people in the general population, which makes it really difficult to look at what are the predictors across the life course, what's happening in young people's lives that's driving homelessness. So the approach that I am taking is, one that is focused on population level prevention. So it's looking at what's happening for young people at the population level before they enter homelessness. And if we can look at some of those drivers, if we can identify some of those drivers and target those, my theory is that we can then stem the flow of young people who enter homelessness over time. But the point to note is it is going to be a long-term process. It's not something that we're going to get, hard and fast answers on. And like any, prevention approach, it takes time to see effects. And I think that's one of the things that we probably need to focus on a little bit more, even though, all of us want, really quick responses, and we, want to reduce the number of young people who enter homelessness quickly. So, like I said, my work focuses on two streams of work, and I want to go through both of those in a little bit of detail. But I think the question that we need to look at first is why use a life course approach? And for me, it comes back to let's think about what is going on for young people from birth to the point that they experience homelessness. And let's try and target some of the things that are influencing the likelihood of homelessness down the track. And the way to do that really is through this interdisciplinary approach. So it's looking at what's going on in a young person's environment, within their family, within their school, within their community, the social context as a whole, not just one aspect of that context. What's happening across development, and how is that development influence aging as someone progresses through their life, and what are the health impacts of what young people are going through. So I don't know if anyone here has heard much about the International Youth Development Study. I hope that you have. It's a long-term study, and I'll go through a little bit of detail about it in a minute. But I think the main points to note about this study is really what we're trying to do is look at the development of health risk behaviours and socially disruptive behaviours. So things like substance use, things like mental health, engagement in antisocial behaviour or victimisation. How were they developing throughout the period of adolescence and into young adulthood? And we want to understand the different drivers of those behaviours. So as I was saying before, what's happening in the environment, what's happening at the individual level, what's happening in family, school, community. And the important, well, not important, but I think a really interesting part of this study is we have a cross-national sample. So we have young people both here in Victoria and in Washington State in the US. And that effectively gives us two opportunities to look at the same questions. So we can look at a question for young people here in Victoria, and we can see if the results to that question then hold for young people in Washington State. If they do, then we can say that those drivers are not really about policy, but they're core developmental processes. If they are different, then we need to look at why that is, and it could be that the contextual environment is different in both states. And just the last point there is, part of this life course approach, is really looking at how does the timing of one's transition to adult roles influence their behaviour later on. So this is just a quick overview of the sample itself. We have several cohorts of young people who were initially surveyed early on in their life, so at 5th, 7th and 9th grade. I don't want to go too much into the details of the sampling process, but I'm happy to send those details to anyone who wants them. And really, the study itself has multiple waves of data. So it first began in 2002, and we followed these same young people through to most recently 2020. So in terms of age, we've effectively followed young people from around the age 10 to 12 period right through to now the mid to late 20s, which gives us a really big opportunity to look at what's happened in early life and mid-adolescence, and then what's happening, later on into later adolescence and adulthood. And so what I've got here is just an overview of some of the things that we have measured with the survey and that I'm looking at in this homelessness work. So we're looking at things like childhood accommodation transitions. How many times have young people moved in their childhood, moved family homes? In their adolescence, were they engaging in things like antisocial behaviour, alcohol or other drug use? What's their family environment been like? What are some of the characteristics of their peer group, of their school and the community that they're attached to? And at this point, I've obviously looked at homelessness as our main outcome, but then we've also started to look at some other health behaviours. So in this case, relationships between homelessness and antisocial behaviour, and also victimisation. So I'll take you through briefly some of the results that we've got. I guess what we've done with this study is really, try and order it quite sequentially on purpose. And the first step for that has been, was to look at if we take these individual, family, peer group and school risks or protective factors, and we look at them just in isolation, what's their relationship to homelessness later on? And so in the sample that we have, we can see, just got at the top here, some of the percentages of the groups that experienced homelessness. So at age 21, we had 6.5% of young people who reported experiencing homelessness in the past year, about 4% at age 23 and 2.5% at age 25. And what we saw in this first study is these factors that I've got listed here, measured at age 13, predicted homelessness at age 25. So effectively what we can say for that is that, young people who were engaging in antisocial behaviour at age 13, that behaviour predicted homelessness at age 25. We can also see, in terms of the family, poor management strategies within the family. So, situations where parents, for example, may not know exactly where young people are at a point in time, or conflictual communication patterns were associated with later homelessness. And the two big ones down the bottom there, which surprised me, particularly being someone who has had a background as a secondary school teacher. Young people who are suspended or who were not achieving academically were also showing risk for later homelessness. But I also just want to draw your attention to these other two factors, so belief in the moral order and pro-social peers. I think sometimes with homelessness, we focus a lot on what are the risks. And part of what I want to do with this work is look at not only the risks, but also what sort of things might protect young people from experiencing homelessness. And so for this one, what we can say is, young people who were engaged with peers who were displaying pro-social behaviours at age 13, that seemed to be protective against later homelessness. So study 2 really tried to look at what are the, developmental processes or developmental paths that we might see in young people who experience homelessness. And so for this one, what we did was look at, and I hope that you can see this diagram. If not, I'll just briefly talk through it. So with this study, what we tried to do was say, okay, if we look at, say, poor family management at age 13, how does a young person, or how does that experience risk 2 years later in other domains? So in this case, how does poor family management affect young people's engagement with peers who might be using drugs or engaging in antisocial behaviour? How does that poor family environment then influence school suspension or academic failure at age 15? And then how do these age 15 factors impact homelessness at age 25? And what we can see here is actually quite interesting. So what we've got is essentially this poor family management at age 13 influenced each of later risks at age 15. So the risks we looked at within the peer group, within the school, and within the community. And again, similar to the first study, what we have seen is, so poor family management influences both school suspension, academic failure, and one's attachment to their neighbourhood. And then those three factors influence homelessness at age 25. So I think the thing to take from this is, yes, we have, young people who might be experiencing problematic family environments, and that's really important. But the other important thing is the way that I guess being situated in that environment then influences risk in other social settings that also influences homelessness down the track. And so if we go to study 3, we've essentially done the same thing, but we've changed the family environment variable. So what we can see from here is how does family conflict influence risk in other social settings? And we see the same thing, that conflict then influenced young people's engagement with peers who are engaging in antisocial behaviour or suspension, or how attached someone was to their neighbourhood. But family conflict also then influenced homelessness through young people's peer engagement. So young people who were in highly conflictual family environments were more likely to engage with friends who use drugs, more likely to engage with peers who were, I guess, displaying antisocial behaviours, and then more likely to experience homelessness down the track. So that's a bit of stream 1, and I hope that I haven't gone through that too briefly, but I'm sure you'll have questions about that down the track. What I want to just look at now is some of the work that we've done around homelessness and its impact on health and mortality. Like I said earlier, we don't know a lot about mortality among young people who experience homelessness, and that's something that is a big focus for me over the next couple of years. But what we do know around homelessness and mortality in adult populations is that rates of mortality are higher than what we see in the general population. There's a broad range of causes for those. Importantly, many of those are preventable. So we see things like death related to suicide or overdose, and accidents. Accidents including acts of violence. And then we see rates higher for females than for males, particularly around mental health. And, when we look across these different, I guess, causes of death, the thing that really jumps out for me, and I think comes through the literature quite clearly, is that not only are people who are experiencing homelessness dying earlier than people who don't experience homelessness, many of their causes of death are preventable, which for me, really highlights the need to look at homelessness from a public health perspective as well as a social perspective. If we can address many of these health-related impacts, then we're likely to decrease the number of people who experience homelessness and pass away. And like I said earlier, we don't have a lot of data on this, but I think the thing that's going to come out of this study is that people who experience homelessness and then are provided with housing or come out of that or transition from that homelessness experience, I think we're still going to see higher rates of mortality among that group. And I think that, is really I guess for want of a better term, it's really going to highlight the fact that, yes, we need to look at housing options, but we need to look at support on a more long-term basis, both socially and from a health perspective. So how are we going to do this? The grant that I've got, fortunate enough to get from the NHMRC, has funded what we call a national data linkage study. So the work for me over the next few years is going to be linking up what we have in terms of national homelessness data with data that we have in the National Health Index, National Death Index, sorry, and then linking those two sets of data to data from the Pharmaceutical Benefit Scheme and the Medicare Benefit Scheme to look at what sort of health care people who are experiencing homelessness or have experienced homelessness but are now housed are accessing. And that will be with people up to about 35 years of age. So I really want to focus on the young group with this work. And I guess what I want to look at here is, what sort of things informed the development of that study. Prior to getting this grant, I've done quite a bit of work around young people experiencing homelessness and their experience of engaging in violence and also being victimized, which really highlights, the health impacts on an ongoing basis of experiencing homelessness in any form. This is, the young people I've spoken to are young people who have been rough sleeping, but they're also young people who've been couch surfing or in transitional or crisis housing. So we've got a range of young people. What I tried to do in this study here is really look at, same with the International Youth Development Study, really look at, how are homelessness, violence and victimization related across young adulthood. And what we can see from this is obviously homelessness at one point drove homelessness at the next point and the next point. The same for antisocial behavior and victimization. But the key thing that came out of this study was homelessness, for instance, at age 21 did not predict antisocial behavior or violence at age 23. It did predict that at age 21, so within time, but it didn't predict it across time. So for this group, we didn't see anything happening longitudinally, which is important because what it points out is the need for intervention at the point that young people are experiencing homelessness. I guess the key thing here is that homelessness for these young adults and for this sample that we have really increased young people's vulnerability to engaging in violence and also being victimized, which in turn heightens risk for things like physical injury, mental health related concerns, shame, stigma, trauma, and also contact with the justice system. So intervening at that point in time that young people are experiencing homelessness or accessing services is important if we want to reduce their risk of violence and victimization. So that was, I guess, a first step with that study. The next thing that we want to do is look at what are some of the drivers within time that might also predict violence or victimization. And I think, things like, based on some of my other work, things like substance use or peers that young people who are homeless are engaging with, housing situations, they're all going to, influence risk down the track. And I think the other point here just to make is that we didn't see a difference in violence or victimization among males and females. And we did only look at male and female gender within this study. So how do we bring a bit of context to this? One of the other arms of my work over the last few years has been to really look at the experiences of young people through qualitative data. And so I went out and interviewed around 60 young people about their experience of homelessness, their concept of home, the way that they saw themselves as young people, and also, what they want for their future. And these are just a few points that have come from that. I don't think that it's anything new. I mean, those of us who are working in the sector have seen this from young people before, and so we know what it's like. But I think in terms of putting this out there, really to highlight what young people's experiences are is important. And they've talked about homelessness being really dangerous, being exhausting, being an issue where each day they combat things like physical assault or sexual coercion or violence. And so I think when we're working with young people, these are things that we need to kind of keep in mind. And we also did ask them about their access to healthcare and how they found that experience. And the biggest things that came out of this were very much around shame and stigma. The shame of experiencing homelessness, but also shame associated with needing to ask for help. The young people that I interviewed were very self-sufficient. So the fact that they needed to seek help for something that they were going through, an injury they had experienced, was the process of seeking help was shameful for them. That's how they felt. Many young people talked about, in healthcare settings, feeling secondary, that power relationship between the medical professional that they were seeing and their own situation. So the judgment, feeling undeserving of treatment or being treated kindly. And, particularly in terms of violence and victimization, there's very much a fear of police and a fear of disclosing what they had been through in case child protection would be called or police would become involved. So I think, these are things we probably need to consider as we continue to work with young people in healthcare settings or other settings that young people are visiting. Which brings me to this bit. So how can we help? For the young people that I interviewed, trust was the most important thing for them, which is, I'm not a clinician and I haven't worked in healthcare settings, but in terms of working with young people, it's really difficult to build trust in a short amount of time. And so, maybe that's something that, we can think about in the healthcare setting. I'm not going to prescribe what that should be. I don't know what that should be, but I think, this is one of those situations where I think we can really take a multi-sectoral approach to looking at how we can build interactions or services that are not only inclusive, but are welcoming for young people to attend, and where they're likely to still feel shame and stigma, but how can we lessen that, I think, is the point. Also, for young people, knowing workers by name was important to them. Many young people talked about having seen workers from different settings, a different worker each time, and that was kind of off-putting for them. And young people wanted to be included in decisions about their own health, and I don't think that's anything new for us as people who are working in this setting, but something that young people highlighted, which I think we just need to really keep thinking about. And I think that the other point there, and this is very much links into shame and stigma, is acknowledging the social context of homelessness. For the young people that I interviewed, it was really clear that engaging in violence, for instance, wasn't about creating some sort of social unrest. It was about protection. And I think that's something that young people feel really, I guess, find it hard to convey to those of us who are not in the same situation as they are. So, what are the key points from all of this stuff? I think the first point is really, it is possible for us to identify drivers of homelessness at the population level. So in young people before they experience homelessness. Those things may be things like suspension from school and academic failure. We need to look more into that. We also need to look into, elements of the family environment that are not at that abuse level that we typically associate with homelessness. I think one of the things we really need to look at in more detail are, what's going on at the family environment level that isn't at that level where services get involved, but is still harmful for young people. And also, what's happening in schools, communities, and peer groups. I've gone through shame and stigma, so I'm not going to go through, that again. But I think in terms of next steps, this mortality work is going to be, there's going to be a lot to do with that over the next few years. I think also, it's really looking at what other life course predictors and drivers can we identify, and do they hold up in other samples outside of the sample that I'm looking at right now? And, exploring prevention approaches. I think, that's a shift that we need to make. Yes, intervention and early intervention is important, but I think we also need to add population level prevention to that in order to start to see some effects over time on the number of young people who do experience homelessness. So I've got just some relevant publications here. I'm happy if anyone wants any more details on any of the stuff that I've gone through today, I'm more than happy to send any publications directly to you. There are a number of collaborators to this work, so I do want to acknowledge the people who are listed there, as well as the young people who have participated in the work that we've done, and the range of funding that both I've had and the study itself has had over time. And that's it. I'm happy to answer questions or have other discussions.
Jess, thank you so much for that presentation. It's just an extraordinarily important area of research. I think the statistics are shocking, and the picture that you've painted around how health inequity presents or the health impacts of homelessness for young people, and the rapidity, the way in which that health inequity is so quick to have an effect as a result of homelessness is really confronting. And so it's been great, to hear about that today. We do have a couple of questions, but I'm going to be really cheeky as the chair and kick them off.
Have one yourself.
Because I think, especially for our Y community, one of the things we're very interested in and that you have covered is around young people's own ideas about what interventions can look like in terms of sort of arresting or addressing some of the health impacts. But I wonder whether you could share briefly with us whether or not, and if so, what young people said could help prior to them experiencing homelessness. So you said sort of a little bit about what they said could help while they're experiencing homelessness. What are the insights you've got around that period before or leading up to homelessness?
Yeah, I think I did a piece on this a couple of years ago, particularly related to the educational context, because I wanted to know what was going on for young people in that time prior to their transitioning to homelessness, for want of a better term, in the educational setting, given what we have seen here around academic failure and suspension. And the biggest things that came out of that were young people feeling they needed to connect with staff. They wanted support, but they didn't know how to get it. And they suggested things like, maybe organizations who work with homelessness could come to the school and just talk to the student cohort in general, or the student welfare, or I'm not sure what you call them these days, but the counselling support within schools, needing more information about homelessness and young people. I mean, there's a lot about mental health, there's a lot about eating disorders, there's a lot about substance use, but the young people that I spoke to, really didn't feel like homelessness was something that was mentioned as a possibility for them as young people. So I think, I think it comes back to this whole thing of let's look at young people and target young people as a whole, rather than focusing on those that we see who are at risk. Because I think, once young people are at risk, we have a chance of losing them down the track. That's going to progress. But if we can, build an awareness, and even if it is just an awareness of homelessness and where to go early on, maybe that can make a difference.
Yeah.
I mean, young people also talked about things like, experiencing homelessness and trying to manage their schooling at the same time. So, going to school but haven't had anywhere safe to sleep the night before, haven't eaten, haven't showered. These are all things that, impacted them. And I think underlying all that was a want to stay engaged in education, seeing the value of that, but not having the capacity to do that in light of everything else.
Yeah. Plenty more to say about that, I'm sure, but I will go now to the questions, and just a couple of a clarifying question, I guess. Helen's asked if you could clarify what does victimization mean, the victim or the perpetrator?
Okay, so victimization refers to a young person who has been the victim of, in this case, an assault. So someone who has been experiencing homelessness and been beat up by another person. So in the study that that we've conducted, violence really refers to what young people might be perpetrating, victimization to what young people might be experiencing.
Okay, well, hopefully that answers your question, Helen. Jess Sharon says, thank you for such an interesting talk. It's striking that even when people get into housing, they might still have poor outcomes, including early death. I guess that means after experiencing a period of homelessness. What sorts of ongoing support do you think could turn this around?
Yeah, look, I think there are multiple things. I think the key thing for me is homelessness itself is a form of trauma. And despite the fact that young people, people in general, might be housed, that trauma doesn't go away straight away. It may not go away for their life. And so I think discussions around trauma are really important here, because we have things like, substance use as a coping mechanism, or other coping mechanisms aside from substance use that might not be healthy per se. So I think there's that aspect around that sort of support. But then I think there are other things that might not be as obvious. So it's things like, for young people who haven't had the opportunity to finish their education, they may be in jobs or employment that is casual or temporary, or, where there's not a lot of income coming through, which then impacts things like young people's capacity to, healthy diets and, that sort of stuff, which I think long term will also influence health and well-being. I think social connection is another one. If we're, I struggle with this a little bit because, in having worked and talked to so many young people, they're very grateful for situations where they do have housing, but loneliness is a big thing, because they've had to leave their group, their peer group, that did give them a sense of safety, even if the environment itself wasn't safe. And the capacity to build new social connections and the opportunity to build new social connections isn't there. So I think this is why we need to really look at homelessness through a health lens as well as a social lens, because there are many ongoing impacts to health and well-being that I don't think we realise and take enough.
That point around loneliness is so important. I mean, we hear that in relation to other areas of care, such as aged care, where just having a roof over your head doesn't necessarily mean you feel connected and have meaning or feel valued in that environment. So very important. Tina asks, I guess this is sort of slightly connected to that prior question. She points out that it's interesting that the Young Australian of the Year, Dr. Daniel Noor, is working to improve access to healthcare for homeless people through his mobile health initiative. Do you have any thoughts on this model of care, whether young people might access a service like that? What might its broader benefits be?
Yeah, in terms of young people accessing that service, I'm not sure. That said, in interviewing the young people that I have, I have to say that one of the things that has come out for them is engaging with other kind of similar peers, but not so much adult networks. And I think what I was saying before around, fear of authority may come into accessing like that, a service like that for young people in particular. That fear of, are police going to be contacted? Is child protection going to be involved? Where young people have had a history of that before. I think those things are things that we need to take into consideration with any healthcare that we present to young people. So the answer is I don't really know if young people are accessing that service, but I think it would be useful.
So just Maya has asked a question about gender and taking into consideration the point that you made about the way that gender has been, I guess, conceptualized in the study to date, and whether or not you're thinking or looking at how to, I guess, add or incorporate or understand more diverse gender identities in the study, and I'm quite keen to know whether or not sort of gender identity and diversity has come up in the qualitative research that you've done.
Yeah, so on the first part, in the International Youth Development Study, we do have a retrospective question around sexual diversity and gender diversity. And I think, at the time that this study and also other, studies I've seen were started, unfortunately, it wasn't something that was at the forefront of people's minds. So I'm glad that it is now. So that we'll be able to put that variable, and that sounds terrible, I know, into the analysis down the track. So that is beneficial. But yes, it has come out in the qualitative work. It wasn't something that I set out to look at in the qualitative work, but I would say that maybe 30% of young people that I interviewed came or identified as gender or gender diverse, or some other category of sexual diversity. So that is something that we're looking at. I think one of the important things with that, and I don't know if this is the forum for it, but I'm going to put it out there anyway. I think for me, as someone who's a cisgender woman, I don't feel comfortable doing that analysis. I don't know what I can't identify with young people's experiences in that sense. But I do have a colleague who is coming on board to look at that data and really look at the nuances within that. So that will be forthcoming. And yeah, I think it'll be quite quite interesting. We're hoping to potentially do some comparison between gender diverse and non-gender diverse identifying young people. Time will tell with this one.
Well, I mean, I think everyone here would appreciate what you've just said there, and also the way in which you're proposing to take sort of gender and sexuality and forward in the study. And certainly there are investigators who are experts in this area that I'm sure you're already aware of and would certainly love to work with you on it. But you may be aware that we have a
reach out, please reach out. If we can put a team around this, then that'll be much better.
And we do have a Wellbeing, Health and Youth Commission of young people who advise around youth health research and translation, and certainly gender and sexuality are key, I guess, areas that they've been pushing for us to sort of really think through and make better incorporated and better researched within the broader field. So really important. I think we've probably got time for just one more question, if that's all right. So Sarita asks if you've looked at the association between homelessness and involvement of young people with the youth justice system, and if so, how the justice system is impacting. And I'd like to know what you think your research tells us about what some of those interventions or changes might be necessary to turn it around.
Yeah. So there are two points that I want to make there. The first one is a little bit off tangent with the question, but I'll go to it first. And I think there's a lot of talk around homelessness policy development going around now. And I think that's important. But I think one of the key things we're not thinking about, but we need to think about further, is what are those points where there is a nexus between homelessness and another setting. Youth justice is one of those. I think out-of-home care is another one. And the third one that really comes to mind for me is young people who are in mental health settings. So I think we really need, if we're going to come up with a policy, I think part of that policy needs to be that young people leaving those settings cannot leave those settings into homelessness. I think that's the first point. Now, so that's a bit aside, but I think that's an important one because, yes, there is a nexus between youth justice and homelessness. And, I think that comes from, well, partly from the fact that young people who are experiencing homelessness have had contact with the justice setting through violence that they've come across or that they've engaged in while they're experiencing homelessness. And I think the second is, like I just said, the release from one setting into the other. We haven't had a lot to look at in that with the International Youth Development Study, but it is a key component of the mortality work that I'm going on to. So one of the focus groups for me is going to be, what is the healthcare access like, and what are the rates of mortality for young people who experience homelessness and have contact with the justice setting. So I'll have to come back in a couple of years and update you on that.
Yeah, no, that would be great. And I mean, I won't put you on the spot with this one right now, but I mean, there is obviously a big debate in Australia about the age of criminalisation, criminal responsibility as well, and and I suppose that's also feeds into this as well. Although I think your point about what happens to young people when they leave some of those settings is very crucial too. Look, I want to just ask one more question, if that's okay. And that's to sort of connect this with the international comparative element of the study. And I just wondered if you could conclude with sharing with us any of the key, I guess, differences that might exist between the two country settings or state settings, and what we can learn about what we could do differently here to improve, I guess, well, to reduce homelessness and improve health outcomes for young people who experience it.
Yeah. I think the first point to make is the drivers of homelessness that I was talking about earlier are no different between the young people who are residing in Washington State and the young people who are in Victoria. So they're the same predictors. So far, there are no state-based or country-based differences in those. And that's important because what it says to me, or what it implies for me, is that these drivers are universal. It's not that they're more pronounced for one country over another. It's that, they're coming up for young people regardless of their context. And I think, what does that mean for homelessness efforts or healthcare access? I think what it means is we really need to take a look at and put the evidence around those programs that are already targeting those drivers. So, for instance, say we have antisocial behaviour come up. There are already evidence-based, tested, effective programs that address antisocial behaviour. So for me, it's not about let's produce something new, or pick bits and pieces of different things and see if that works. It's about coming up with these, I guess, universal key drivers and using what's already there to test if addressing those drivers reduces homelessness. I really think we need to put the evidence base around that. Yeah.
Well, that is a somewhat hopeful note to end on, I think. We already know what can work. And so the impetus there is to really, scale and implement better. And it seems to me that the research that you're doing is really providing a very strong case for that to happen. So Jess, thank you so much for presenting to our Why webinar today. Like I said, it's been, I think, a very powerful and interesting presentation. We will, with your permission, share the recording from today on the website, so that people can look back on it, and anybody who hasn't been able to join us can still see it. We wish you all the best with your research, and hope that we're working with you into the future. Thank you, and thanks to everybody for joining us today.
Thank you, and likewise, thank you to you, and thank you to everyone who's come along. It's been lovely.
Thanks, Jess.
Thanks.